This is Tom Fox, and welcome to AI in Healthcare in 5, a weekly briefing. In this new podcast on the Compliance Podcast Network, we're going to take a look at 5 top stories from AI in healthcare over the past week. This podcast joins AI Today in 5, our daily show, and AI in FinTech in 5, a weekly briefing on AI and FinTech. If you want to keep up with AI and healthcare, this is the podcast for you. Thanks so much for listening, and I look forward to visiting with you again. Today we have 5 curated stories for you for the week ending May 15, 2026. We begin with a story from KFF Health News, which reports the Trump administration seeks to relax patient safeguards around AI healthcare tools. The administration wants to remove protections for patients so that there can allegedly be more innovation. Of course, it's the patients who are going to pay for this, but that's not the concern of this administration going forward. So be careful out there. Next up from AMJ, the American Medical Journal, a very interesting article on patient acceptance of AI is shaped by trust barriers. This is really across, I do a lot of AI podcasts, as most people know, and trust is probably the number one blocker for the not simply the acceptance, but use of AI. And AI healthcare acceptance is shaped by this as well. It's strongly linked to perceived trust into technology, concerns over data privacy, and the clarity of communications. Patients are far more likely to accept AI when they understand how it supported clinical decision-making and when it's integrated into familiar care pathways. Alongside trust, ease of use, and perceived benefit play a central role in shaping attitudes. Next up from Medical Economies. Where is AI actually making a difference in healthcare? Rising health costs, workforce shortages, and a volatile supply chain are making healthcare companies use AI or scale the use of AI as a strategic priority, deploying the technology at more than twice the rate of the broader economy. It is helping to close the healthcare worker gap. It's improving patient outcomes by elevating the standard of care. It's helping to remove the insurance headache, probably the biggest bugaboo for any patient, certainly anywhere in America. Next up, from the Wall Street Journal, the quest to use AI to help find new drugs. The NVIDIA founder earlier this year was touting the company's tech prowess, and he teased the chief executive of a pharmaceutical company that they weren't using AI to help develop new drugs. Well, this hopefully will move into the background as finding new drugs through the use of AI will be an increasingly important use of the tool. And our final story comes to us from the American Hospital Association, which reports that 4 healthcare systems are transforming their care with AI. And it's a really interesting article, particularly around such topics as detecting congenital heart defects in utero, identifying peripartum cardiomyopathy, accelerating diagnosis and decision-making in radiology, and virtual nursing going forward. The bottom line is responsible transforming healthcare delivery is a key part of AI, and I hope that you will utilize it all going forward. We're going to be off next week, so we will be back with you on Friday, May 29th for our next episode. Hope you will check out the full panoply of AI-related podcasts on the Compliance Podcast Network. Our other new podcast is a weekly summary of AI in banking and FinTech. Of course, we have the daily AI in 5, and we have Compliance and AI. Thanks so much for listening.